Good night. Thanks for inviting me. My name is Dr. Juliet Ardiles. It's a great pleasure and honor to be here. Today I will be talking about virus and the risks of lung cancer prevention and treatment. Okay, lung cancer is the most common cancer in male and the second most common among females, but in Europe and worldwide. Moreover, lung cancer is the leading cause of death due to cancer in males. The European region accounts for 23% of total cancer cases and 20% of cancer-related deaths. Tobacco smoking is the main risk factor for lung cancer. And other risk factors include exposure to asbestos, household use of biomass fuel, environmental pollution, and genetic factors and chronic disease. Okay, and it's important to note too that recent COVID-19 pandemic has shown that cancer patients have a high risk from SARS-CoV-2 infection, with an increased risk of complication and death, particularly in the patient with lung cancer. Also produce an exacerbated immune reaction and lung injury that could induce tumorigenesis and the long term. The molecular perturbation caused by some infection agent leading an oncogenesis are well known in several tumor models, including cervical cancer, stomach cancer, head and neck tumors, and some types of leukemia and lymphomas. The pathogenic rules of virus has not yet been well established in lung cancer. However, evidence of the integration of viral DNA in tumor cells and epidemiological research based on clinical studies and several meta-analyses suggest a possibility cause rules on infection agents in slug malignancies. Smoking has a potential role in increasing the susceptibility of a lung tissues to viral infection, in addition to affecting oncoprotein function. Studies in mouse models show that tobacco smoke alters the immune response, contributing to viral pathogenesis and linked to lung function deterioration. Virus related to lung cancer and proposed mechanism of oncogenesis. Um, HPV E6 and E7 protein surgeon P53 BCL2 NRB this protein to cell cycles and apoptosis and level epidemiological evidence high HPV genome found in tumor genome meta-analysis indicating great risks of lung cancer in HPV positive subjects. First author is Karnowski. EBB and the model of oncogenesis such as previous premaline lesions type 2, latency and activity of EBNA, LMP1, LMP2, and other EBB protein linked to tumor promotion. High meta-analysis indicating a high risk of lung cancer in EBV patient, EBV genome in lung cancer tissue, in vitro models, and HIV immunosuppression, favoring tumor immune escape, and meta-analysis indicating HIV patients have greater risks of lung cancer, to that fivefold increase in the risk of lung cancer in PLWH who smoke. Prevention and treatment of oncogenesis virus. Okay, prevention of infection by oncogenesis virus is complicated as except for HPV. There are no approved vaccines for the viral agents described in the previous section. However, there are no data supporting a decrease in the incidence of risks of lung cancer in the population vaccinated for HPV. After viral infection has been detected, there are some strategies to avoid viral activation to block of diminish oncogenesis and transformation. In EBV infection, smoking cessation should be recommended for a smoker, and the primary prevention measure for upper respiratory tract carcinomas. The retail in also susceptibility for lung cancer prevention. Nasopharyngeal carcinoma is a good model to evaluate the effect of target EBV as an anticancer therapy. Currently, there are several phase 3 clinical trials evaluating drug that activated the lytic phase of EBV or EBV vaccines. In the addiction at phase 3 trial of biological therapy is using multivirus spatial T cells and in patients who have undergone allogeneic stem cells transplantation, surfing from new or reactivity CMV, EBV, and adenovirus infection. This new type of therapy could provided in treatment from the patient infected with oncogenesis virus in the future. Okay, COVID-19 lung cancer, the future change of research. Um, the COVID-19 pandemic has had a major impact in global health. Okay, in global health. And despite in the research carried out in recovery time, much remains to be determined, especially regarding the complication and possible long-term sequentialities of severe SARS-CoV-2 infection. A recent published letter by Cali. Well, the conclusion, the role of viruses in lung cancer development remains unclear but supported by epidemiological data on infection and tumor cells. All basic research studies have no potential oncogenesis mechanisms of virus in the lung cancer cell lines. Further research is needed. Tobacco smoke can contribute to viral oncogenesis by producing local immunosuppression and increasing viral pathogenesis. Thank you for attention.